Okay, it is 5:15, and with four of us in attendance, we do have a quorum. And I think Commissioner Thorpe is going to call in as soon as he can. Dr. Edwards, would you lead us in prayer tonight, please?
Yes, I will. I'll be glad to. Let's bow our heads. Heavenly Father, thank you for allowing us to be together tonight in spirit and by audio. And I know we can't be there in person for various reasons. And please, God, be with us. Continue to be with our community as we fight this pandemic. Please bless us, God, to do your will in the benefit of our health system. And it's in Jesus' name I pray. Amen.
Thank you.
Amen.
Tonight's meeting is 5:15, and it is in accordance with Governor Lee's Executive Order 771 that has extended remote meetings. Obviously, Donnie Ogle is out sick tonight, and he'll be coming back at a later date. And Commissioner Thorpe should be calling in anytime now.
I'm here.
Oh, okay. Commissioner Thorpe is here. Hey, how you doing there, buddy?
Hey, wonderful.
Okay. The meeting tonight is being recorded and will be made available on the health system website. The first item on our consent agenda is the consent agenda. Are there any items in the consent agenda that the board would like to be pulled for further discussion? If not, I'll entertain a motion to accept the consent agenda as submitted.
I'll make a motion.
Okay, motion made by Dr. Edwards.
Second, David.
Second by Commissioner Sanders. Any discussion? All those in favor say aye. Opposed say nay. Okay. The next item is quality report.
This is Carrie, and I'm gonna be giving Courtney's report tonight.
Okay, thank you.
I'm gonna do the best I can. We are, our next quality meeting is next week. So we don't have a full quality update until we'll give a full report for quality update at the end of February, the February Board of Trustees. This is just a quick overview.
Okay.
You'll see a couple of graphs there on patient satisfaction. Those scores reflected in 2020 do reflect, we believe, through our analysis of the data, that it has to do with visitation policy during the COVID-19 pandemic. We did have a little bit of a bump there in the third quarter, and if you'll remember, we did loosen the visitation guidelines in the third quarter, but we did have to lock it back down because of the surge starting in October. And so we believe one of the questions on the survey does point to the fact that we did not do a good job with, or we had to limit visitation with patients, and that was very frustrating for them. And it's the same thing with the ED overall rating. It's down for the fourth quarter, and again, we had to lock the hospital back down for the pandemic. Outpatient overall rating is consistently above goal and continues to do well. We are working on, just to let you know, we've got sort of a refresh on patient satisfaction. Courtney spent an hour with the department directors approximately 2 weeks ago and gave them a good information on how to utilize the Press Ganey website. Tomorrow, during our department directors meeting, she's going to review how they use the website and how to drive results in their departments based on the top impact questions for each department. And we can drill that down to know which item is the most impactful for their patient satisfaction in each department. So tomorrow we'll have another refresher, and then going forward, the senior team is going to discuss patient satisfaction drivers in our monthly meetings and weekly meetings with our department leaders.
Okay.
Performance improvement projects, okay, is there any questions with that? Okay, performance improvement projects, we are continuing to do outpatient testing with COVID-19, and we have serviced about 1,800 COVID tests for the community and for employee health, and we have done a great job with decreasing the wait times. Those patients are driving up to the back of the hospital, and we have someone go out to their vehicle to get their COVID test. It's been working very well. We've actually seen some comments in our patient satisfaction survey that tell us that they appreciate that service. So that's a really good performance improvement activity that we're doing. Regulatory update, we were notified today that all regulatory bodies will be delaying surveys for the year of 2021. That's going to put the Joint Commission approximately 18 months to 2 years behind. So that will definitely delay our Joint Commission accreditation visit, which would have been in March of 2022. And, it's going to be interesting to see how all the regulatory bodies get caught up. The only type of survey that they are doing right now would be on a state level for a immediate jeopardy situation in long-term care, that type of thing. We have been waiting on the lab regulatory visit from CAP for over a year. They were supposed to be here in February of 2020, and it looks like it will continue to be delayed. We do anticipate a state pediatric survey in February, but again, it could be delayed. Home Health Hospice is waiting on their annual state visit, and Donaldson Care Center has been waiting patiently for their state visit, and again, it's been delayed since July of 2020, and we just anticipate it at any day now for them to come. We do believe they will come to us just because of all of the issues we have had over the past 12 months. Haven't had any infection control or complaint surveys in the past quarter. COVID-19 update, we had supply issues, but we have now received our supplies. They were on back order, and again, we are continuing to do many antigen testing, and we do have a lot of PCR testing as well. We're continuing to combat high volumes of COVID-19 positive inpatients. We did get another ventilator. We do appreciate that. That gives us a good supply of ventilators and vapotherms that we can use on our COVID-19 patients, and we do appreciate that from you, from the Board of Trustees. We are in the middle of giving the COVID-19 vaccine. We have given round 1 of 1A1 and I believe the 1A2. It's a hierarchy of who gets the vaccine first. And we have now given the second dose. And I believe Courtney told us this morning we've given about 180 doses. Daryl, is that correct? Is that what you remember?
Yep.
And we have another 100 doses available. We have a clinic on Thursday that we will be servicing about 90 people. So we are just steadily administering the vaccine to those that voluntarily are wanting it. And that is what I have for quality.
Okay. You're going to do the HHH board report?
I can. I'll just be reading it to you because
Okay.
I'm sorry I didn't get an update on that. It looks like that they've had some falls from home health, none on hospice, but neither of those falls had any major injury. It looks like they've had no med events. They are continuing to work on performance improvement in home health. They're working on reducing their unplanned ER visits. That must be a new CMS quality measure that it reduces their payment if they have ER visits during a episode of home health or hospice. So that's a good performance improvement activity for them. another one that they're working on is readmissions to the hospital. I know that Sam in our case management department is working with Debbie Yorba to continue to work on readmissions.
Okay.
That's about all I can answer for that.
Okay. Okay. Well, you did good. You did very good. Are there any questions? Are there any questions? If not, I entertain a motion to accept the reports as submitted and brief.
I make the motion, Dr. Edwards.
Okay, Dr. Edwards made the motion. Second by, is it Dr. Morrison?
It's Dr. Morrison. Mm-hmm.
Okay, any discussion? All those in favor say aye.
Aye.
Opposed say nay. Senior administrative report.
All right, I'm
Okay,
back
if you
up
feel
again.
like it. Okay.
My nursing quality report is very brief. I just would like for you to continue to understand that our county continues to be in the highest category for percent positive of COVID, according to the CMS criteria. Inpatient numbers have sort of waxed and waned over the last 2 weeks. We are back up again today. When we got here this morning, there was about 18 patients. Many of those, I'm not for sure of the percentage positive, but I know that there was a great deal, maybe 30 to 40% positive on COVID-19. So we are experiencing just a great deal of volume that, of course, we are not used to. And so it stresses the whole system when we have that type of volume here. ICU is full today. Something that just for your information, our surrounding hospitals are continually on diversion right now. They'll take a trauma, but that's about the only thing they're going to accept from transfer from us. We have actually had to transfer 4 patients over the last 10 days by fixed wing to Louisville, Kentucky.
Wow.
That's how full the Tennessee system hospitals are. I put in that third bullet down that we've seen a real decline in the resilience of our staff. Many of our staff in the med-surg, ICU, and ER have finally contracted COVID-19. We did well for 10 months, and then all of a sudden we just started having staff members that have come down with it. And, of course, being sick, and then every nurse, on our medical unit and the ICU have been in mandatory overtime since October. So we've got a real resilience issue with the staff. They need a break. The last thing I would mention is that the last board meeting, you asked me to have a action plan with APP to improve physician perception, community physician perception. And after discussion with Dr. Seaman, we will be doing 2 things. One, we will work on press gaining physician communication score. They currently are at the 1st percentile, so they have they can go anywhere but up, and and they have a lot of work to do there. So we will use that as one of our monitors, and I will bring that to the Board of Trustees throughout the year to show you improvements, hopefully. The second thing that we would like to concentrate on was the pediatric piece. And so Dr. Seaman is going to work with the physicians on utilizing the community pediatrician or pediatric on-call to consult with them on level 2 and 3 patients in the emergency room. Those are the sickest patients. The patients that come in with a stumped toe and a sore throat, we will not be consulting with the pediatrician. But those patients that come in that are sick, that are level 2 and 3, we will consult with the pediatrician in the community.
Okay,
and
thank you very much.
That.
Okay.
Okay.
Thank you. Well, what about radiologists of Huntsville? There was 2 areas, was timeliness and customer service, I believe. They were marked down 2 on those.
Anthony, honestly, I did not follow up on that. I was so busy trying to make sure APP, we got an action plan with APP that I did not.
Anthony, I had something happen this week that I hadn't had. This is a lady that has been my patient for years, always gets her mammograms here. And this last one, when Dr. Lehman was working with Huntsville, evidently Huntsville didn't take her insurance, and she ended up with this whopping big bill, and she's never had a bill on a mammogram here. So she was giving me a real hard time about getting a repeat mammogram this year.
Mm-hmm. Yeah, UHC.
Yeah.
Yeah, we got confirmation that they don't have a contract yet with UHC, but they said they'll work with her.
Well, they didn't work with her last year.
Well, we called them. They said they would work it out.
All right. Well, I will pass that on to her because
Yeah.
she was pretty hot in the office.
I believe Bob forwarded you the email.
Yeah, I forwarded the email. Carrie called
Yeah.
Park, the director there. So.
Okay. Wow. Okay, Bob, you want to run through the financials?
Yes, sir. First report there for everybody is the scorecard, and again, I won't belabor and go through all the details, but just to kind of piggyback on what Carrie said, as far as volumes go, December very high, almost double basically what we ran last year in December, so you can imagine the difference. So we ended up with an inpatient ADC of 17. That doesn't include observation. So our med-surg floor and ICUs have been busy. Again, down in the nursing home, the ICF has been down some. We're meeting this week to talk about that and how we can try and get that volume to come back up. Deliveries were solid. EMS runs were solid. Home health and hospice activity continues to be strong. So overall, pretty good month. And basically that translates when you step down to the bottom. We did have an unusual event as far as financial reporting goes with the forgiveness of the SBA loan. So that was recorded. But if you exclude that, which is an unusual item, if you will. Basically, the system was able to post $145,000 surplus. And again, volumes were the main reason for that. When you could drive that kind of volume, you get the labor efficiencies and et cetera. So that's basically what I wanted to kind of bring to your attention as far as the financial numbers go. On the next page, I had some things I just wanted to update again. A couple things, kind of unusual things basically related to the COVID environment. We were notified in this month that we were awarded an $84,000 COVID grant from the state, and it's to assist rural hospitals with COVID prevention, detection, and preparedness. And basically this should be similar to what the state granted us back in June. The eligible expenses look very, very familiar, so we'll be turning that information into them soon. We do have till June to do it, but I can guarantee you that we'll be able to cover that $84,000 very quickly with all the testing and the special drugs that are being utilized, as well as the vaccine process. All the time committed to that preparation, et cetera. The other item I really wanted to kind of point out too was something we were very excited to hear about. If you all remember, there was some debate whether hospital providers, this came down from the national interpretation, they wanted to ensure that healthcare providers were not going to take time off, if you will, if they didn't need to be, because we obviously have to have an active workforce to take care of the sick under COVID. And so they were basically saying that if they wanted to take time off, they were going to have to use personal time. Well, we were able to get clarification from Horn Group. And so basically, in a nutshell, we were able to go back till July 1, and anybody that has had COVID illness from July 1 forward, we were able to take a credit under what they call the Families First Corona Virus Response Act. And so that's a big employee benefit. We had a lot of employees that were disenchanted, and rightfully so, that they had to use PTO time when they were sick with COVID. And so we were filing our quarterly 941s just this week, and we took the full credit of $120,000. So that's a nice penny that has been rendered by the federal government to assist folks. The last item that I wanted to kind of talk about is a major process that I'm involved in with the Horn Group that we talked about before when we engaged them. And that is the reporting process for all of the lost patient revenues, as well as the healthcare related expenses to COVID. The federal government has come out, they came out with a reporting process that they wanted to enact January 15th, but obviously they didn't expect the second surge of COVID to hit. They have now changed that, which we're accustomed to now. Everything's kind of flex. But they basically said just register for now, and we'll let you know later. And then, of course, we all know that they extended the national emergency another 3 months as well. So Horn Group thinks that our reporting won't probably start until another 3 or 4 months. But what that basically means, in a nutshell, is that the longer they extend this emergency time frame, that means we get the opportunity to include more and more of the expenses related to COVID, as well as the hindrance to our normal patient revenue production. So it will help justify the funds that we received earlier. So again, we won't know until that's all done, but we're actively getting the processes started to capture all those related expenses. And Horn Group is working with me as well. We've taken a first blush review through December as far as the lost revenues, and we'll continue, obviously, to update that as we progress. So that's a lot, but I just want to let you know that's probably one of the most pivotal processes this institution is going to be going through to see how much of that HHS funding and stimulus money we'll be able to retain. So with that, I'll entertain questions on any part, whether the financial numbers or those financial matters.
Any questions for Bob? If not, Daryl?
Okay. On my report, kind of hit on some of the growth initiatives. Tomorrow we're meeting with Hologics to go over the pro forma about the wound care program. Thursday, meeting with Blake Bentley, the CEO of Sports Med, about pain management orthopedic surgery here at Lincoln, with Dr. Beasley, basically, given notice that at the end of the year he'll be retiring. So we're looking at orthopedic surgery service line. Dr. Uzi, our new hospitalist, started January 4th. He's worked, he's worked 2 weeks in January. And then also Carrie and I are working, and Bob are working on the telecritical care coverage for our hospitalist program and for other physicians that want to utilize that. On the people section, Russ and I continue to meet frequently, discuss strategies, and to plan accordingly. Dr. Thomas and Carrie and myself have been meeting with nurse practitioners for our hospitalist program, looking for some PRN coverage. We have hired 2 individuals, a Ginger Hamilton and a Teresa McGuire. And so they'll be training and in-servicing with Dr. Thomas and Dr. Uzi during the month of February. Attended a lot of meetings with my department directors, as well as Carrie's and Bob's department directors. Been to department meetings with the employees, and of course have been rounding on all the entities within our healthcare system, and have attended the employee orientation and employee of the quarter presentations for this past quarter. One thing that I have not accomplished that I told you that I would, but is having the town hall meetings at the Donaldson Care Center. And due to some COVID issues out there, and staffing issues, not staffing issue, but COVID issues, have not done that, but that's on my agenda to do in the next couple of weeks of February. So I will be able to report that back at our February board meeting. And with that, Chairman Taylor, that's my report.
Okay, any questions for Darrell? If not, I entertain a motion to accept the senior leadership reports as briefed and submitted.
I'll make the motion, Dr. Edwards.
Okay, Dr. Edwards made the motion.
Second.
Second by Dr. Morrison. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Okay, Chief of Staff, Dr. Klein?
He has not made it yet, Chairman Taylor.
Oh, okay. Were there any questions? Did the board have any questions? You're going to do the Donaldson report, Darrell, or are you?
I'm going to just, if you'll accept the report as submitted, unless there's some questions I could answer.
Okay. Are there any questions that the board like to ask Darrell regarding the Donaldson Care Center report? If not, I entertain a motion to accept the report as submitted and briefed by Darrell.
I make a motion, David.
Okay. Motion made by Commissioner Sanders.
Second, Jack.
Second by Commissioner Ashley. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Did anybody have any questions or comments about the Patrick Rehab and the EMS report? If not, I entertain a motion to accept those reports as submitted.
So moved, Jack.
Motion made by Commissioner Ashley.
Second, Dr. Edwards.
Second by Dr. Edwards. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Darrell, are there any new business?
Chairman Taylor, I'd like to ask for an executive session.
Okay. Is it anything on the capital purchase? Is that just information?
That's just information.
Okay.
I will say,
yes,
Chairman Taylor, I will say that at the last board meeting, the approval was for the ventilator, which Gary mentioned that we have received, and also for the Lucas devices for the EMS, and those have been received also.
Okay. All right. Thank you.
And to add to that, Mr. Chairman, when we look at this capital expenditure summary, I will note that those EMS pieces of equipment, I believe, total about $44,000. They were not on this report as of December 31 because that took place in January, but they were basically encumbered. So just so everyone's on the same page, when you look at the bottom and it shows 126 left to spend, we need to just recognize that 44 has been encumbered by this EMS equipment. So that basically leaves about 82,000 left.
I thought we were going to use CARES money to purchase that.
Well, we will use that as a valid expense, and it certainly will be, as well as the ventilators noted above. There's about 66,000 for them. The issue is you don't get that until the end of that reporting process, which I talked about. So you're probably, in all reality, looking at not being able to know for certain that will be recouped, but the Horn Group says it should be until the end of this calendar year.
Okay.
I think that's a lock, though. I would say I would not worry about it. That will be, but we didn't want to deduct that from here and say that, hey, that's going to be covered under CARES, et cetera. We're sticking with its capital. This is the way it is. It's a conservative approach.
Okay, Bob, the COVID ventilator is listed twice on the items. It's the fourth item from the top. Is that intentional, or
Yes,
are we
sir.
getting another one?
No, it's absolutely intentional. We bought two this year. We bought one early in the year, and then
Okay.
we just got this latest one approved as well. So we have two new ones and one
Okay.
that's a little on the age side. So we have three that are in our ICU.
And they're being used.
And they're being
you got
used.
that portable one that the state gave us, don't you?
Yes, sir, but portable's not ideal in the inpatient setting.
Okay. All right. Okay. Do we have enough ventilators? Do we need to think of one more, or what?
At this juncture, we think we have sufficient, but obviously we're well aware of it and recognize that if we were to have another surge activity, we may need to be coming back and asking for another one.
Okay. I think another surge is predicted, isn't it?
I'm not.
We're good right now.
I think-
The most we've had has been 4 people on a vent. We would have
Okay.
that covered.
Okay.
Okay.
Okay. All right. Darrell, that will conclude our regular board agenda, and okay. Entertain a motion to adjourn.
A motion to adjourn.
So moved.
David.
Okay, motion made and properly second. Any discussion? All those in favor say aye.
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 All right. Hey, thank y'all, and I hope everybody stay healthy. Carrie and Bob, hope y'all continue to improve, and thank you for what you do. And thank you to each and every
Thank
one of you for what you do as well, and the rest of you, Darrell, Russ, and all the rest. So thank you.
All right. Thanks, Anthony.
Thanks.
Have a good
All
night.
right. All right. Good night.
Good night.
Good night.